So these are the disclosures that Maria went over in the first few minutes of the webinar. And now I'll be getting to the presentation. Are you able to see my screen?
We didn't see the disclosure slide.
Can you see them now?
Yes.
Okay. So now I'll be getting to my presentation. Hello, everyone. My name is Ikeku, and I am a member of the American Lung Cancer Screening Initiative, ALCSI for short. Today, we'll be giving a presentation on lung cancer and lung cancer screening. We are grateful for the opportunity to present to you today. Before we get started, I'd like to request that everyone is muted during the presentation. However, we would love to take any questions at the end of the presentation. So please feel free to put your questions in the chat box for us to address. If you're interested in learning more about ALCSI, we'd like to invite you to visit our website at www.alce.org. And please email us with any questions at the time. Before I get into the content of the presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. ALCSI is a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. We are a team of over 70 passionate students and doctors located across the United States. We've worked with community organizations like the South Asian Network and American Indian Cancer Foundation, as well as city and state health departments, including the NYC and Connecticut health departments. We hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. Today, we will discuss both lung cancer and lung cancer screening, addressing questions such as how common is lung cancer, what is lung cancer screening, and how can you get screened? Firstly, let's overview lung cancer statistics. To start things off, lung cancer is very common. It is the second most common cancer in the US, excluding skin cancer. This graph shows the American Cancer Society estimates for the number of new cancer cases in the United States. The graph estimates new cancer cases in 2022 for the most four common cancers. As you can see, it is estimated that 236,740 people will be diagnosed with lung cancer in 2022 in the US. To put this number into perspective, it is estimated that about 6% of people in the United States will develop lung cancer in their lifetime. That means about 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. Moreover, not only is lung cancer very common, it is also very fatal. Lung cancer is the leading cause of cancer-related death in the US and in the world. In 2022, it is estimated that lung cancer will claim the lives of 130,180 people. This graph shows that the American Cancer Society estimates for the number of cancer-related deaths in the United States. As you can see, lung cancer is far more fatal than breast, prostate, and colon cancer, causing more deaths than all of these three combined. Lung cancer makes up about almost 25% of all cancer deaths, resulting in about 350 deaths each day. Every year, there are about 50,000 more new cases of breast cancer, but lung cancer causes over 90,000 more deaths. Nearly 50% of lung cancers are diagnosed at distant stage when the 5-year survival rate is only 6.7%. The stage of lung cancer has a major effect on the survival rates of diagnosed patients. This is a graph looking at the proportion of patients with lung cancer by stage. Stage is a way for doctors to classify a cancerous tumor based on tumor size. If the cancer has spread to lymph nodes, and if the cancer has spread to other locations in the patient's body. Currently, most lung cancers are diagnosed at distant stage, when the cancer has spread beyond the site in the lung where it originated. This graph is based off data from 2014 to 2018, published by the National Cancer Institute. As you can see, about 25% of patients are diagnosed at a localized stage, while about 48% of lung cancers are diagnosed at a distant stage, when the cancer has spread to other locations in the body. So why is this important? It's important because the stage that lung cancer is diagnosed at correlates directly with survival. One way that doctors track the survival of patients is by looking at the 5-year survival. As you can see here, the 5-year survival for lung cancer at the early stages is high, but the 5-year survival significantly drops as the disease progresses. With lung cancer being such a morbid disease, some of you might be wondering why the majority of lung cancers are diagnosed at a later stage. Well, the majority of patients are diagnosed with late-stage lung cancer because they don't start feeling any of the symptoms of lung cancer until the cancer has grown and spread. The most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. Additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset of wheezing. However, when people become symptomatic, this cancer has grown and spread to a point where it is more difficult to treat, and the prognosis is poor. If the diagnosis of lung cancer has to wait until the patient has symptoms, it is difficult to catch the lung cancer early. So the question we ask is, how do we catch lung cancer early if patients are asymptomatic? One of the best ways we can do this is through lung screening. Lung cancer screening is done using something called the low-dose computed tomography scan. If you're eligible for lung cancer screening, it is recommended that you get an annual lung cancer screening. In the coming slides, we will discuss what lung cancer screening is, who should get screened, and how to get screened. An important distinction we want to make is that lung cancer screening is done using low-dose computed tomography, also known as low-dose CT, and not the chest X-ray. We use low-dose CT scan because it provides more detailed pictures than chest X-ray and is better at finding small abnormal areas in the lungs. The picture on the left is a picture of a chest X-ray. The abnormal area in the lungs is indicated, but is unclear. On the other hand, the image on the right is a picture of a low-dose CT scan of the chest. As you can see, this image is more detailed than the chest X-ray and enables you to see abnormal area in the lung with greater detail. The question that researchers wanted to answer is, how effective is the low-dose CT scan at detecting lung cancer at an early stage? An important lung cancer screening trial called the National Lung Cancer Screening Trial, or NLST, tried to answer this question. The NLST was a large national study with over 50,000 patients. The goal of the study was to determine the effectiveness of using a low-dose CT scan to detect lung cancer in patients considered high risk for lung cancer. The study included two groups: a group of patients who received annual low-dose CT scans, and a group of patients who received an annual chest X-ray. By comparing the stages at which cancers were caught between these two groups, the study wanted to determine if the low-dose CT scan was better at catching more lung cancers at an early stage. As you can see, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most lung cancers at an early stage, while the X-ray diagnosed more patients at stage 4. This has important implications for survival. Because the low-dose CT scan caught more lung cancers at an early stage, these cancers were much more likely to be treatable, and the prognosis was much better. This translates to a 20% reduction in mortality for those who underwent lung cancer screening using low-dose CT compared to an X-ray. A concern with any screening test is accuracy. Essentially, how good is the low-dose CT scan at catching lung cancer? For every 100 individuals undergoing CT lung cancer screening, 86 will be negative. Of those 86 that are negative, 97.7 to 100% truly do not have lung cancer. This means that the test is very good at identifying people who do not have lung cancer. That is, if you do have lung cancer, the test will most likely come back positive, and the test will not miss your cancer. If we move our attention to the 14 individuals that are positive, 12 turn out to be negative for cancer primarily with follow-up imaging alone. This means that if your test result is a false positive, it's really easy to rule out cancer using further non-invasive imaging. The 2 individuals that have a positive test result and truly do have lung cancer are more likely to be diagnosed at an early stage than if they were not to undergo lung cancer screening. This means that their treatment options and prognosis are much better. The results of the NLST were published in 2011, 10 years ago. Several studies have been published since then, further confirming the life-saving benefit of lung cancer screening in high-risk populations. One of the most important is the Nelson trial. In February of 2020, the results of the Nelson trial were published. Like the NLST, the Nelson trial had 2 groups. However, unlike the NLST, the Nelson had a group that received low-dose CT scans and a group that received no screening of any kind. A total of 13,195 men and 2,594 women between the ages of 50 and 74 were randomly assigned to undergo CT screening at T0, which is baseline, year 1, year 3, and year 5.5, or no screening. The results confirmed the life-saving benefit of lung cancer screening by low-dose CT. In the screening group, 58.6% of lung cancers were diagnosed at stage 1. In the non-screening group, 13.5% of lung cancers were diagnosed at stage 1. Early detection translates to a reduction in mortality. In the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when compared to no screening. The Nelson trial also showed that with improvements in low-dose CT technology, the false positive rate was reduced significantly. Lung cancer screening significantly reduces lung cancer mortality. But who should get screened for lung cancer? The United States Preventive Service Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer. Right now, they recommend that people between the ages of 50 to 80 who have a 20-year pack-year smoking history or greater and who are current or former smokers who quit within the past 15 years get annual low-dose CT scans. The current screening guideline requires you to have a 20 pack-year smoking history. Now, pack-year is probably a term that most of you have not heard, but it's just a way for doctors to track your smoking history over a period of time. A pack year is defined as smoking a pack of cigarettes per day for a year. So, for example, if you were to smoke 1 pack a day for 20 years, that would equate to a 20 pack year smoking history. Alternatively, if you were to smoke 2 packs a day for 10 years, that would also equate to a 20 pack year smoking history. Here are 3 easy steps to calculate your smoking pack year. The important takeaway is that there are many different ways to reach 20 pack years, and the pack year is a way to help doctors track your smoking history. I'd also like to point out that the USPSTF guidelines were recently updated. The USPSTF has slightly different guidelines a little over a month ago and updated the screening guidelines on March 9th of 2021. The previous screening guidelines only recommended that individuals between the age of 55 to 80 with a 30-year pack smoking history or more get screened. Under the new guidelines, the lower age bound is lowered from 55 to 50, and the pack year smoking history is lowered from 30 pack years to 20 pack years. These new guidelines will nearly double the number of eligible individuals for lung cancer screening in the United States. Notably, the most apparent increases in eligibility will occur among women and minorities. However, while these new guidelines will include more high-risk individuals, they only include individuals with heavy smoking histories. There are other risk factors for lung cancer that are not accounted for in the current screening guidelines. Smoking is a primary risk factor for lung cancer. When comparing with people who have never smoked cigarettes, a current smoker has a 25 times greater risk of lung cancer. About 8 out of 10, around 81% of deaths from lung cancer in 2022 are expected to be caused from smoking cigarettes. After smoking, the next leading cause of lung cancer is exposure to radon gas, which is released from soil and can build up indoors. Moreover, secondhand smoke causes almost 3% of new diagnoses of lung cancer and is expected to cause about 3% of deaths from it in 2022. Additional risk factors include exposure to asbestos, family history of lung cancer, COPD, and previous radiation therapy to the lungs. It is important that we recognize these additional risk factors because although lung cancer has a strong association with smoking, there are a large number of people in the United States who have never smoked that still get lung cancer. Never smokers are defined as individuals who have smoked less than 100 cigarettes in their lifetime. Because lung cancer has such a strong association with smoking, people are often surprised to learn that lung cancer in never smokers accounts for about 10 to 20% of lung cancer diagnoses and is the 8th leading cause of cancer-related death in the US and the world. More never smokers die from lung cancer each year than people who die from ovarian cancer. This graph shows the proportion of lung cancer cases that occur in people who have never smoked in their life and people who have never smoked. It is then further broken down by whatever they are, a current, former, or never smoker. As you can see, 80 to 90% of lung cancers occur in people who have smoked during their lifetime, and about 10 to 20% occur in never smokers. Interestingly, women are more likely to be never smokers when diagnosed with lung cancer. In fact, in the US, 60 to 7% of never smokers diagnosed with lung cancer are women. Right now, lung cancer screening is not recommended for individuals who have never smoked. However, understanding lung cancer in never smokers is a current focus of research. With the development of new screening technologies and risk models, there may be a way to identify high-risk never smokers who should be screened for lung cancer screening.
All right, lung cancer screening saves lives. Next slide. In summary, lung cancer is the leading cause of cancer-related deaths in the US. It is so deadly because most lung cancers are diagnosed at a late stage when they have spread to other locations in the body. Importantly, early detection through lung cancer screening by the use of low-dose CTs can reduce lung cancer mortality by up to 33%. Next slide. Currently, only 5.7% of high-risk individuals are currently getting screened for lung cancer. To highlight how low this number really is, we compare the lung cancer screening rate to the screening rates for breast, cervical, and colon cancer. All 4 of these cancers have screening tests that are recommended by the USPSTF. Right now, only 5.7% of high-risk individuals are getting screened for lung cancer. This rate is extremely low in comparison to the screening rates for breast, cervical, and colon cancer. The American Lung Association estimates that if we were to screen every high-risk individual recommended by the USPSTF in the US, we would save 48,000 lives. However, we are only screening 5.7%, which means that a lot of lives that could be saved are not being saved. And why is that? Next slide. The lung cancer screening rate is low for a number of reasons, including limited awareness and concerns about access to the screening, the cost of screening, and the safety of screening. In the next slides, we'll discuss each of these topics. The important takeaway, though, is that lung cancer screening can help reduce an individual's risk of dying from lung cancer. The first potential concern we will address is the cost of lung cancer screening. The average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. However, there are a few exceptions. Medicare will only cover lung cancer screening until the age of 77. Not all state Medicaid plans cover lung cancer screening. And the third one is patients will still pay the usual fees for provider appointments before or after the scan. As I just mentioned, unfortunately, not all state Medicaid plans cover lung cancer screening. Here is a map updated in July 2022 showing which state Medicaid plans do not cover lung cancer screening. Pink states have a state Medicaid plans that cover lung cancer screening. In the blue states, their state Medicaid plan does not cover lung cancer screening. In purple states, the state Medicaid plans cover lung cancer screening and updated guidelines are used. In gray states, this information is not available, and in the white states, there is no fee for service program. The first step to getting a patient screened for lung cancer is having them talk to their primary care provider. There are certain questions a primary care provider has to ask and topics that have to be discussed. One of these is the patient's past year smoking history, which we saw how to calculate in the earlier slides. To find accredited lung cancer screening centers, patients can go to the American College of Radiology website. They can type in the state or city they live in to see where accredited lung cancer screening facilities are located near them. The American College of Radiology website is located on the bottom left-hand side of the screen. This is a map of the accredited lung cancer screening facilities in North Carolina. As you can see, each pin represents an accredited screening center. As far as how the screening experience of getting a low dose CT goes, it will require you to lay on your back for about 5 minutes. You'll be doing something very similar to the patient just laying on your back and just relaxing. One thing to note is that this process will not hurt at all. And because this is a low dose CT scan, you do not use contrast. This means that there will not be any needles or injections involved. The low dose CT scan is non-invasive, fast, and completely pain-free. Additionally, the amount of radiation exposure is very low. A way that the doctors measure the amount of radiation a patient may receive is through a unit called the millisievert. It is just a way to measure radiation and compare the levels of radiation received during different activities and over time. For a low dose CT scan, you will be exposed to 1.5 to 2.0 millisieverts of radiation. This is a lot lower than a full chest CT scan, which requires a radiation dose of 8.0 millisieverts. To put that in perspective, you are exposed to 3.11 millisieverts of radiation a year from just breathing, cosmic radiation, eating, and the radiation from the earth. So a low dose CT scan exposes you to less radiation than you are exposed to from just existing on Earth, which means that the level of radiation you receive from an annual lung cancer screening is very small. That being said, this is always something that patients can discuss with their primary care provider. So a patient talked with their primary care doctor. The PCP referred the patient to a screening center, and they received a low-dose CT scan. What is next? The doctors will receive the results of the patient's screening test and will follow up with the patient to go over the results. As far as results go, there are 3 most likely outcomes. The first outcome is that the scans are normal. If that is the case, then the patient should look to get repeat scans in a year. If the scans are abnormal but probably benign, then the patient should talk to their doctors about the next steps. This may include more scans, tests, or biopsies. If the scans are abnormal and suspicious, then the patient will likely have to undergo additional testing, such as biopsy. So lung cancer screening saves lives, but a question you may be wondering is, can individuals still get screened for lung cancer during the COVID-19 pandemic, and is it safe to do so? During the pandemic, the number of cancer screenings has decreased significantly. However, lung cancer won't stop because of the pandemic. If a patient is at high risk for developing lung cancer, it is important that they get their annual lung cancer screening test. Right now, most hospitals have operating lung cancer screening programs, and patients can wear a mask during the entire lung cancer screening process. If patients follow the necessary precautions, like wearing a mask, lung cancer screening during the pandemic is safe. The pandemic should not deter patients from getting screened for lung cancer. Now we will talk about the impact of radon on their lungs. Radon is a radioactive gas released from rock and soil and is invisible, odorless, and tasteless. Radon can build up in homes and can go undetected for a while, and at high levels, it can cause lung cancer. Next slide. So this is a map of the radon zones in the US. So radon testing is easy and affordable. It's very simple to go into a hardware store and buying a $10 to $30 kit and just getting tested. And you can also hire a specialist, and they can also help take care of screening radon testing in your house as well as in any environment that you work in. And there are simple screening procedures available provided by the EPA and the USPS TFF that can show you how to test your home as well as look at lung cancer screening for radon. Next slide. Another question we often get is how vaping and e-cigarettes use affects lung cancer risk. Vaping and e-cigarettes have relatively new phenomenon and have become more prevalent in the last decade. While the long-term effects of vaping and e-cigarettes are still being studied, it is clear that for individuals who have never smoked before, they can increase their risk of lung cancer. E-cigarette devices and vaping fluids contain nicotine derivatives and heavy metals, among other chemicals. They arise both as elements of the e-liquid and a result of organic reactions in the electronic cigarette device. Various studies demonstrate in vitro tests in transforming and cytotoxic activities of these derivatives. Vaping causes fewer health risks than smoking, but it is not a risk-free activity. Vaping can increase heart rate, decrease air volume in the lungs, and increase heart airway resistance. Furthermore, e-cigarette device use has been significantly increasing, particularly among young adults and non-smokers, making it an area of significant concern for the future. Additionally, while lung cancer screening has the potential to save many lives, it is important to address smoking cessation in the context of lung cancer screening. Lung cancer screening is not a substitute for smoking cessation. Likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer and lung cancer screening. And lung cancer screening is the best way to detect lung cancer early. Using both is the best way to fight the disease. For every year after an individual quits smoking, the risk for lung cancer is reduced by 8 to 17%, depending on the kind of lung cancer they have. Another reason that smoking cessation is important is because it is required by Medicare and Medicaid services for lung cancer screening programs. However, we do understand that smoking cessation can be difficult. There are a lot of resources for people trying to quit smoking. Some great programs are the renowned Health and Wellness Quit Smoking Program and the Nevada Cancer Coalition's Quit Smoking Program. As this presentation comes to a conclusion, we want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase the lung cancer screening rate. Lung cancer is the deadliest cancer in the world, and while lung cancer screening can save so many lives, very few high-risk individuals are getting currently screened. We are working to address all aspects of this issue. We wrote and advocated for House and Senate resolutions expressing support for Lung Cancer Awareness Month and early detection through lung cancer screenings. Last December, our Senate resolution was passed by unanimous consent. Additionally, we are working to teach communities across the country and across the world in countries like India, Mexico, the UK, and many others about lung cancer and lung cancer screening. Lung cancer is the deadliest cancer in the world, but by working together, we can overcome it and save millions of lives. It starts by working together to raise awareness and initiate lung cancer screening programs in our communities. We believe that educating communities, especially students, about lung cancer, especially students and nurses, and other medical professionals that work in hospitals and other areas about lung cancer and lung cancer screening is crucial to lowering the number of deaths associated with the disease. Students greatly impact and influence the healthcare of the students, and other medical professionals greatly impact and influence the healthcare of their parents. And we hope that by educating students about educating about these important measures that can be taken, we will not only be able to help educate other people, but also help family members and relatives with lung cancer screening. Next slide. So in Chapel Hill alone, our organization has done several events. We have worked with several organizations such as the White Ribbon Project and Lung Cancer Initiative North Carolina. This past couple 6 months, we've done a couple white ribbon builds, and all the white ribbon builds, ribbons that we build are donated to lung cancer patients and lung cancer survivors in North Carolina alone. We've donated about 20 so far, and we have about 36 more left to build. And we're planning to give those out as well. Lung Cancer Awareness Month starts in November. So this past November, we had an amazing start, and we've done about 3 events so far in that month. And we had a great start off with on November 1st by hosting an event at UNC Cancer Hospital, where we talked to lung cancer patients and survivors, and it was a great event. And then on November 19th, we also had another event where we had a whiteout, and we talked to all the football players and all the people that showed up to the game, and spread more awareness about lung cancer. Next slide. So last couple things is, so anyone is eligible for lung cancer screening. Anyone with lungs can get lung cancer. And so we have this link here about a QR code that will contact one of our ALCSI partner doctors about lung cancer screening, and can help you find someone in your area or someone to get that lung cancer screening for that person that you're looking for. Next slide. Last 2 things is that if you're 18 plus, and I assume everyone here should be, if you can just fill out the survey helps us on improving this presentation, but also on what you guys learned throughout the presentation. We'll just leave the QR code for a bit, but that concludes our presentation, and we'd love to open the floor up for any questions, and we welcome any questions from any of you guys.
So if anyone has questions, they can actually unmute and ask the questions or put them in the Q&A.
Yep, definitely, Sharon. We can definitely send the slides to Maria and Kit, and then we can send them to you, I guess. I think they should have your emails if I'm not mistaken.
So one question that I have for you all, I know you mentioned the vaping as unfortunately a smoking alternative, and while it may be safer than smoking, it's still not a healthy behavior, particularly for youth, it seems. Does the ALCSI have any initiatives or collaborate with any community partners about education targeted for that population?
So we have chapters all across this. We have a college chapters all across the country, and it's a bunch of college kids that are really passionate about talking about lung cancer screening and just spreading information. And so many of our chapters in other states and in Chapel Hill as well, we talk to the youth about stuff like this, and we do have information that we talk about, like how vaping and e-cigarettes has some sort of connection to lung cancer. And we always have sessions, and we talk about that in our slideshows. But yeah, we do have information about that as well.
It's kind of become an epidemic.
It has, unfortunately, in the youth especially, and it's kind of because like there's still a lot of research going on, especially on lung cancer in relation to the vaping and e-cigarettes. So it's still information that's being developed, but like right now they see there is a connection so far. Yes, also, yeah, we can share for Sharon as well. We can share those screening locations as well. I guess we'll send all the information to Maria and Kit, and they can just send it to you.
If everybody has gotten the link to the survey, I just wanted to point out the future events that UNC, or at least ALCSI in general, has coming up. So Tuesday, January 24th, from 6 p.m. to 8 p.m., we have a table talk at Union Capital Boston. And then also Monday, February 13th, from 12 p.m. to 1 p.m., we have a presentation to Oak Cliff Bible Fellowship Comprehensive Cancer Support Group. Those are two events that we have coming up in the next month. If you
But
want to-
also,
Oh, sorry.
go ahead. I was gonna say our website is also there, and if you have any more questions, we definitely love to hear from you guys. And if you're interested in like joining our organization or helping us out, all the information is available on our website, or you can just send us an email at that email there, and one of us will definitely respond.
So thank you guys so much. And if you don't mind, Ike, if you could, unless you have additional slides, forward to the other evaluation slide. So for the participants, those of you who have attended to obtain credit, nursing continuing professional development credit, you must complete the evaluation. And here is the SurveyMonkey link or the QR code, whichever works for you. And please be sure that you save this certificate. There will not be another way to verify your participation. And we appreciate your feedback. I know that ALCSI, I always have to think about those initials, also had a survey for you to complete, but this one is for your actual continuing education credit. And then I think there is one more slide if everybody's had the opportunity to take a picture of the QR code or get that link. There is one more slide that also will talk about the survey or the evaluation for NCPHA. Kim, you might want to jump in if you have something else to add about that piece of it.
Yes, this is Kim Dittman with NCPHA. We are a site for the Region 4 community-based training, which is we receive money each year to do professional development training for public health employees. And so we, as a part of that, we have to do an evaluation for each webinar we offer or any kind of training. So this is part of one of those webinars or trainings. So if y'all could please, there's another QR code that should be coming up. Can you advance the slide? There we go. Okay, so this is the Region 4 community-based training evaluation. It's a really short evaluation, and we appreciate you completing that so we can get submit our results to Emory University, which is our site coordinator. And we thank y'all today for your time this afternoon. Thank you, Ike and Rod, for your presentation. I think everybody learned a lot about lung cancer on this webinar, and we appreciate y'all taking your time away from work to attend it. Everybody have a great weekend.
Thank you so much.
Thank you as well.
I think Ike will have to end it since he's the host. Okay, there we go. Thank y'all.
I don't know that you heard me say that because I was muted, but very helpful, very informative webinar.
Of course. Thank you. Thank you for having us.
Yes, thank you so much. Take care.
Thank you. You too.